As we come on the air tonight, doctors are urging the public to get their flu shots. Local health officials say there is a possibility someone could have the coronavirus and the flu at the same time, and they want to prevent that from happening. NBC 15's Laura Barczewski talked with a local urgent care doctor about this issue. Laura, are doctors seeing an increase in the number of patients asking for the flu vaccine?
Kim, Dr. Richard Euler at Compass Urgent Care says they compared the number of flu vaccines they gave out last year to this year, and they are actually seeing quite an increase in the number of patients requesting them, which they say is a good thing. Alabama doctors and health officials say it's important now more than ever for everyone 6 months of age and older to get the flu vaccine.
It's going to be very difficult for the patients and the medical community to really separate out. Do you have COVID? Do you have flu? Because the symptoms really mirror each other.
Dr. Karen Landers with the Alabama Department of Public Health says they're advising the public to get their flu shots now because they tend to see flu outbreaks during winter months, and it takes about 2 weeks for the flu shot to kick in.
And that's why right now is a very good time to get your influenza vaccine before the holiday season and before more people are together. But we also want to remind to use the measures to reduce the spread of COVID-19 as well.
Compass Urgent Care Dr. O says because the symptoms can be similar, they're going to start testing for the flu and COVID-19 because it is possible for someone to be co-infected with both at the same time.
There's always that possibility, and we don't know what this flu season might look like. A lot of us in the community think with everyone wearing their masks that we might have a low flu season. We just don't know.
Dr. Landers says they hope that if more people are vaccinated, there will be fewer hospitalizations due to the flu this year.
We do know that the demand on our healthcare system with COVID-19 has been quite significant, but we are seeing a slight decrease now in our hospitalizations, and we want to continue to keep our hospitalizations as low as possible so that hospitals can render the care not only for patients with COVID-19 or if someone is hospitalized with influenza, but for other healthcare problems that require hospitalization.
Dr. O says for those of you that might be allergic to eggs, that is no longer an ingredient in the flu vaccines being given out this year. Kim?